Okay, hi everyone. I am Dr. Jeannie Doyd, naturopathic doctor, and this is my lovely colleague, Dr. Tonia Winchester, naturopathic doctor. We both practice on Vancouver Island. I am in Port Alberni and Tofino, and Dr. Tonia is in Nanaimo. And today we are going to talk about your thyroid. So,
yes, why don't I start by asking you some questions, Jeannie? So let's just start at the beginning. What is the role of the thyroid gland, and what are some indications that we might be deficient or out of balance?
the thyroid controls the body's metabolic rate. It controls the body temperature. It regulates temperature and metabolism. It controls all the organs in the body, the heart, the brain, the muscles, the digestive system. It's a big player throughout the body. It's located right here, and it's controlled by the pituitary gland, which is in the brain. So when you have low thyroid, there are a variety of symptoms that exhibit throughout the body. One of them is a cold body temperature, being cold all the time when other people are warm, being very tired, losing hair. Interestingly, 5 to 8 times more women experience thyroid problems than men. And it's worse during or after pregnancy and during a transition into menopause. And it's also worse with stress. Other symptoms are depression, mood swings, PMS, menstrual irregularities, infertility, constipation, dry skin, brain fog, memory problems. So it affects the whole body.
Yes, it is a big one. Wow. Okay, so can you talk to us about the different thyroid hormones and what testing is available?
Yeah, so testing is done through blood, and it is critical that we test all of the thyroid hormones to get the full picture of what the woman is experiencing. So TSH is the thyroid stimulating hormone, and this is secreted by the pituitary gland to tell the thyroid to make thyroid hormones. This is usually all that is tested by most physicians. What I like to do is I like to test all the thyroid hormones. So the active hormones are T4 and T3. So T4 is made by the thyroid, and it is converted in the liver and kidneys with enzymes that make it into T3, which is your active thyroid hormone. T3 is also called triiodothiamine. So most physicians use Synthroid or L-Troxin, which is T4 therapy for low thyroid. But sometimes they're missing the whole picture. Sometimes the patient needs supplements or T3 therapy to help that conversion from T4 to T3. And sometimes the picture is missed by just testing TSH, because TSH, when it's high, it means thyroid hormones are low, typically. And when it's low, it means thyroid hormones are high, typically, because the stimulating hormone doesn't need to be stimulating, doesn't need to be secreted when thyroid hormones are high. That's the theory. However, I've seen in many patients, TSH is normal, but they have a low T3. So they could be missed on a general TSH test. Also, I've seen TSH being low, which typically means hyperthyroid, and still T3 and T4 are low. And that is a pituitary problem, meaning the woman might be extremely stressed, so the pituitary just isn't functioning to make the TSH to begin with, or there could be some other underlying condition like a pituitary tumor causing that as well. Other hormones you can test for thyroid are the antibodies, TPO and thyroglobulin antibodies. So these would indicate an autoimmune disease against the thyroid, like Hashimoto's or Graves' disease. And often these are missed as well. When there's an underlying autoimmune condition, we need to treat the whole person for what's happening to their immune system that it's attacking the thyroid. So we need to look at the whole body and supporting the whole body to support the person.
Yeah. Did you have anything else you wanted to add there?
No, it's a lot.
Okay. I'm just going to add something, because one of the things I'm most grateful for as a naturopathic doctor is that we get to do this testing in blood. And the way that the British Columbia lab algorithm is if the TSH is normal, then they don't pursue the other testing. So they don't test the T4 and they don't test the T3. But as you've just described, we can see normal TSH and abnormal, thyroid hormones. So we get to kind of override that and run them anyways, which is nice, which is great.
Yeah, so we have an option to check off the boxes we want to check off as naturopathic doctors, but mainstream medicine, they check off all the boxes. They don't get tested because the system won't cover it unless TSH is abnormal. So they are missing quite a few cases of underlying low thyroid.
Yes, absolutely. Okay, so then we've got these imbalances. What do we do next? So what supplements or dietary changes do you normally recommend for your patients?
Right, so the mineral iodine is used in the bloodstream to make T4 and T3. So if somebody's deficient in iodine, they will automatically be low in T4 and T3 thyroid hormones. That being said, taking iodine at high doses is a no-no because it will shut down the thyroid as well. So iodine at low doses along with other minerals can help the thyroid function better. Selenium is good as well. And foods that are high, in iodine would be table salt, seafood, table salt, iodized table salt, seafood, sardines are high in both selenium and iodine, so they're a good food for the thyroid. Zinc is another great one. Tyrosine, magnesium, fish oils, which is an anti-inflammatory, which would help the whole body. And then looking at the diet. So it's important, if a woman has low T4, for instance, there usually is an underlying gluten intolerance or food sensitivity or inflammatory gut issues. So the gut is critical for thyroid hormone production. So it's important to remove food sensitivities, either through food sensitivity testing or elimination diets to figure out what foods are causing inflammation and causing the immune system to be depressed or creating autoimmune against the thyroid. So looking at each individual, coming up with an individual meal plan based on plant-based diet, avoiding sugar, gluten, dairy, inflammatory foods, anti-inflammatory diet. These things have been shown to help thyroid function. One more thing, I just want to mention goitrogenic foods because these are in the media about, don't have broccoli, Brussels sprouts, and kale if you have low thyroid because they're goitrogenic, meaning they block your iodine absorption. However, these foods are only goitrogenic if you eat them raw, and you'd have to eat an enormous amount of them, like kale and broccoli, like 3 times a day, and juicing them and whatnot to really have an effect to block your thyroid. So I usually don't focus on removing those foods for thyroid health. I focus more on removing food sensitivities, inflammatory foods, and gluten specifically for thyroid.
Awesome. Yes, thank you.
Tonia, Dr. Tonia, how does toxicity play in the role of thyroid health?
Yeah, so when I'm looking at root causes of illness, I'm really thinking about 3 things. I'm thinking about stress, I'm thinking about toxicity, and I'm thinking about nutrient deficiency. So you've just covered the nutrient deficiencies, and that's so awesome. Now, from a toxicity perspective, the thyroid is a very fragile gland. And it's really susceptible to the environmental toxins that we're exposed to, the things that we're breathing, the things that we're touching, the things that we're eating. Now, you mentioned iodine. That is a halogen gas if we look at the periodic table. And there's a few other halogens that will actually compete with iodine and bump iodine out of the thyroid effectively so it can't make the hormones that it needs to make. So bromine, chlorine, and fluorine. And so we see these, the chlorine and the fluorine in, depending on where you live, the city drinking water. We see it in pools. So people that swim a lot, I see this correlation often where avid swimmers that are in the pool every day will have impaired thyroid function. And the bromine shows up as bromides, typically in flame retardant materials. We see this all over our house, sadly, in the mattresses, curtains, carpets, that kind of thing. So these are the main sort of toxic elements that will impede thyroid function because they compete with that iodine.
Excellent to be aware of.
Yeah.
Mm-hmm. And what can thyroid imbalances mean from a mind-body perspective?
Yes, I love the mind-body work. So this area of the body, it's the throat, it's the neck, it's all about our communication, our authenticity, our expression of who we are. So it's about voicing our truth standing up and voicing our opinion. So I'll often see when, especially women, are having a hard time doing that because sadly, culturally, we're trained not to, that's not okay, right? We'll see this impaired thyroid function. It's so neat to kind of see how life and the body are paralleling each other. It also has to do with listening, though, whether that's listening to yourself inside and really honoring that little voice that's calling you to, go over here instead of do this thing over here that you were told. So there's an inner listening and also an outer listening. Sometimes people have almost like a veil over their reality. So that's really what the thyroid from a mind-body perspective is showing us. So when it's balanced, when the energy of the thyroid is balanced, we see people that are able to just freely be themselves, express their needs, stand up for what they feel is right. Versus when it's out of balance, we'll see sort of meek, quiet, shy, sort of intimidated people. Mm-hmm.
So interesting to look at it from that perspective too.
Yeah, and I mean, it's not going to parallel every time, but in my work, it matches enough that I think it's worth considering and looking at. Yeah.
Yes, and how does stress affect thyroid function?
Yeah, so that's our third root cause, right? Stress, toxicity, nutrition deficiency. And you mentioned stress affecting the thyroid. And just to kind of solidify the biochemistry of what's going on, the stress hormone, cortisol, we've talked about this numerous times over the last 8 videos that we've made together. The cortisol is actually going to do 2 main things. So one of the things it does is it actually shuts down production of the T3 and the T4 at the gland level. So the thyroid stops effectively making those hormones. And the second thing it does is it actually blocks the conversion that you were talking about of the T4 to the T3 in the liver and the kidneys and other body tissues. So not only do we produce less when we're stressed, but then we also see less conversion to that active molecule. So it's a huge biochemical salad that happens. And for women especially, there's this triad between the thyroid, the ovaries, and the adrenal glands, that cortisol releasing gland, and they all interact, they all play off each other. But really we're looking at a reduced production and reduced conversion.
Yes, cortisol blocks that conversion of T4 to T3, so it's so important to also treat the adrenals when you're treating the thyroid.
Yes, but actually, interestingly, the thyroid can impede, if the thyroid function is low for maybe a different reason, it can actually affect how the adrenal glands are producing cortisol, which we do need. We kind of villainize cortisol, but it's actually something that we do need, just even to get out of bed, we need cortisol. So if the thyroid's not functioning well, we can actually see deficiencies in that system as well. So they're all interacting and playing off each other.
Mm-hmm. Yeah. Great. Well, thank you for joining me today, Tonia. And we are going to be live next week discussing our passion for naturopathic medicine and why we are naturopathic doctors. So stay tuned. It is Naturopathic Medicine Week this week coming up. So stay tuned and we'd love to see you then. Bye.
Awesome. Bye.